So this Friday, we're going to be broadcasting live from Busamed Gateway for our big favor. This, I think, could be our biggest of big favors. It's called Pain to Possibility because someone will be receiving life-changing surgery before or on Mandela Day. So we're looking forward to someone's life-changing. And you know what? Yesterday was a big day because our 3 possible patients were at Busamed. They're already there. They had to undergo a series of tests to determine which one of them is eligible for the surgery. We had Dawn and Musabia and Lyndon, who were all there. They had their checkups. We have one of the doctors with us here right now.
Good morning, Dr. Molla. Thank you so much for joining us, Dr. Zaheer Molla. Thank you.
Good morning, everyone. Good morning to your listeners.
So we were very nervous for these 3 patients because they were nervous before they had to go through and do their test. So how were they selected from all of the thousands of people who entered and shared their stories?
Sure. You know, it was. We had read every single applicant that applied for these surgeries, and I must say the stories were incredibly heart-wrenching. It brought some of the team members in the panel to tears listening to their stories. But, you know, we had to select 3 out of all the applicants. It was really difficult. I think we looked at those patients whose surgery could make a big difference in their lives. The most, I guess, from the others. All of them needed surgery. I guess these would make the biggest difference to them. And who's made sense in terms of their risk, in terms of their workup. And we'd make sure that they're not being treated in other hospitals and we're not pinching them off other treatment plans. So we looked for patients that really deserved the surgery and whose stories made sense and would make it a life-changing experience. We tried to keep into the theme of what we were trying to achieve with this incredible initiative. And I must be honest, I think we did that yesterday by getting down to 3. We got to meet them yesterday finally and get to really hear their stories from them. You know, it was really heartbreaking to hear what they've been going through.
Yeah, I don't know how you guys do it, but as a doctor, I suppose, what is the difference between those who have access to medical aid and doctors who come in and they have difficult surgeries that you have to discuss, and people who had no idea that they could possibly have this kind of intervention? How different is that?
Massive. I've worked in both sides. I've worked in the public sector and in the state and in the private sector. And those that have medical aid get fast-tracked a lot quicker. I mean, they get to surgery in much faster time, and that often, you know, knee replacements, hip replacements have made up most of the applicants that we had. And those patients struggle awaiting surgery for long periods of time in the state sector. Here you get sort of fast-tracked. Yesterday we got to meet them. Some still needed investigations to be done, so we did that on the day we met them to get like the diagnosis spot on and already have their treatment plan. They've got tailored treatment already established in a single day. This would take weeks or months, waiting in a queue in the state sector. It's really unfortunate. But I think this is an incredible opportunity for the one that gets selected to have their surgery at Busamed Gateway.
So when you're looking at them yesterday during the assessments, what was done? Because, I mean, I know the 2 are similar but also very different because it's knees, but then the other one is an injury, but then we also have hemorrhoids. So what was done yesterday?
So it's a good point. I think, remember, we read stories that were heart-wrenching, but then what patients told us what they thought they had. And yesterday was the time to meet them, hear their story, get a good medical history, then examine them, good clinical examination to make sure that the diagnosis was correct. And if we had any doubt, we were able to do some tests yesterday, give them an opportunity to ask us questions on what is planned, what's going to go ahead. So it was time to meet the faces of the people that we had read stories about. And to be honest, I would have loved to have met a few more patients that wrote to us because all of them had incredible stories.
Well, Dr. Zaheer Molla, he's with us here this morning. He's part of our Mandela Day a big favor. One of the 3 finalist patients will receive possible life-changing surgery. And I want to know, so here you are, you've done the medical, you've observed, and you've done all of the, I suppose, medical side of it. But I'm sure you have to find out more about the people who are about to receive these surgeries.
We really were touched by every single entry that we got. We didn't even get to see all of them. There are thousands. When it came to choosing the final patients or the final people, What medical, practical, and personal factors helped guide those decisions and that decision?
That was quite challenging. I think, like I said previously, we looked through every single applicant and to see who was most eligible, and all seemed very eligible. So we looked at their stories and tried to figure out which one had the most quality impact on their quality of life, and who was struggling the most, and where we could really go from pain to success, and who had waited a long time and had a difficult story to tell us. Combining that with the risk assessment, which was checked out yesterday to see if they were fit for surgery, to see that the diagnosis was accurate. So we combined a whole lot of factors to put together to see, well, it was a panel. There's a lot of us that sat together and teased out every single applicant. Heart-wrenching stories, but I think we've narrowed it down to the correct 3 patients based on their stories and their diagnoses and the impact of life, and where we can really make a big change and they move their quality of life from what it was to what it is. We're trying to really make a big change here.
So, Doc, what happens between now, Wednesday, and surgery day?
So all the workup was done yesterday, and the diagnoses they've got tailored treatment plans all drawn up. So from now till Friday, they're just going to wait in some a little anxious and wait to see who gets selected from the 3. And then relax to surgery, get fit, eat healthy, get fit for a longer operation if they're having knee surgery done, a little bit shorter for the hemorrhoid patient. But it's important that they mentally and physically prepare themselves.
Yeah.
And Doc, just finally, beyond the surgery now, and I'm happy you mentioned the knee, I'm sure there's rehab involved. Can you maybe just paint a picture for us, the kind of support the patient needs to achieve the best possible outcome after surgery?
So after surgery, patients generally, for maybe not so much for the hemorrhoid patient, for the knee surgery involves some physiotherapy. It takes it's a couple of weeks of non-weight bearing and then gradual weight bearing onto the knee. But the physios take them on that journey quite nicely to get them fully ambulant again. And in a couple of weeks, they'll be up and bouncing around like normal without... We ask patients to, if they are overweight, to lose weight, especially with hips and joints. But physiotherapists work their magic, and generally patients have a quite smooth and uneventful recovery.
Wow. Well, we look forward to seeing you on Friday. I know Carmen has asked for special permission to be able to hand over the scalpels and the swabs.
No, I definitely.
Remember, you said you want to be
in any way, shape, or form.
You want to be
in any.
Was it
surgery.
Should we label it for you, Carmen? We can label the instruments.
I'll do the wheelchair. I'll push the wheelchair for the guys with the knees off.
I can't be. I mean, I'd love to help out, Doc, but I can't. When I give blood and they prick my finger, I pass out. I'm like,
he's lying. He gives blood every 52 days.
So we'll label it for Carmen. Carmen have all the instruments labeled, and she can just pass it out. And we got a wheelchair pusher. It should be great on Friday. Looking forward to it.
I think we've got all the staff necessary and covered.
I'm sure.
This is going to be...
East Coast team. Great.
I'm not going to lie. I'm so excited that we can be a part of this initiative. We throw this word around, this phrase, life-changing, but it quite literally is. Can you imagine not being mobile for years, not being able to move, not being able to go upstairs, not being able... Any of these, and that is about to change. It's amazing. Doc?
We at Busamed are looking forward to it. We're very excited.
I'm excited.